If a conference involves people traveling from Europe, traveling from the rest of the world in the Middle East and so on, in a conference or meetings with more than 15 people, we have asked that we postpone and suspend that at least for the next 30 days.
Speaking during the opening of the 120-bed isolation facility at Mbagathi Hospital, the health CS said the facility will serve as both isolation and treatment center. Mutahi said that the government will set up another 300-bed capacity isolation facility at Kenyatta University Referral Hospital to offer additional support should there be coronavirus outbreak in the country.
In the event, just in the event that this facility is overwhelmed, we hope not, we pray not, but in the event that that happens, we will have another 300-bed capacity that we are currently working on at the Kenyatta University Teaching, Referral and Research Hospital.
All the level 4 and 5 hospitals in the counties have until March 15th to set up isolation centers, even as the national government is conducting training to community health workers for additional support. Well, this is one of the rooms that will accommodate patients who come in with symptoms of coronavirus. And of course, from what the CS said earlier on, is that this is not only a facility or an isolation facility rather, but an isolation and treatment facility. And as you can see over here, we have 8 beds in this particular room, fully fledged to accommodate some of the patients who will be admitted here in the event that there is a coronavirus outbreak in the country. As part of the government's contingency plan to prevent coronavirus outbreak in the country, Mutahi said screening using thermoscanners is being conducted in all points of entry.
There are those who may not realize that you are being screened because sometimes we are using thermoscanners. So I have heard people say, I passed by the place and I wasn't screened. You were screened. You just didn't know that you were. So let me make it clear. Nobody is going to come into Kenya without screening. At the airports, at the ports, we are making arrangements even in other areas where people walk into Kenya, let alone fly into Kenya, in Busia, in Namanga, and other centers.
The CS also noted that the country has procured sufficient protective gears for all the health workers. So far, 1,100 health workers have been trained. He also warned against xenophobic attacks and racial profiling, especially of Asian nationals in the country. Despite the ban on international meetings, other events in the country will continue. However, Kenyans have been urged to exercise caution and practice good hygiene.
Government officers traveling outside this country cannot do so if they are going to areas that have been said to be affected areas, Italy and the other ones. Therefore, there is a ban to travel to any of those places, may it be for conferences, may it be for meetings, unless it is absolutely necessary.
The opening of the Mbagathi Isolation and Treatment Facility is in accordance with President Uhuru Kenyatta's directive to have the facility up and running by Friday the 6th. The deadly coronavirus has claimed more than 3,000 lives and over 100,000 others infected. Winnie Lubembe for Ebru TV.